Well, I think the MMRF is already doing a lot. Certainly, there have been significant funding opportunities that the MMRF has put forth to enable teams of researchers to study collectively specific aspects of how immunotherapy works. I think the MMRC has been critical in terms of a lot of clinical trial development that is going on. And I think this partnership with academia and industry and biotech has been critical to the velocity with which a lot of these things have progressed. There's a lot of challenges. I think, we're still in the infancy. I mean, I think there's a lot of very exciting data, but we don't know still who the ideal patients are. So patient selection is an issue. I think when one looks at the durability, for example, of CAR T cells, the question is, how can we potentially identify patients that stand the highest likelihood of benefiting, especially for therapies such as CAR T cells that has a significant toxicity associated with it, but more importantly, I think has a significant price tag associated with it. And for society to sustain those kinds of costs, I think it's really only warranted if the cost benefit is as high as we can possibly make it. And so I think where the field is moving in general is really trying to do a better job at identifying patients that a priori may be more responsive to immunotherapy, or to potentially modulate the patient's immune system to augment the overall efficacy of their therapies. So immunotherapy differs from conventional therapy in several ways. One is that for the most part it is a patient-specific therapy, as we talked about earlier. Unfortunately, it's so much more labor-intensive, many of these. There are challenges in terms of manufacturing. CAR T-cell therapies can take up to 4 to 6 weeks to make, and so this isn't an off-the-shelf product that you can just get for somebody. And so by definition, you're probably losing some patients that really can't wait those 4 to 6 weeks to get the therapy. And there's manufacturing issues associated with a lot of these things. So classical chemotherapy is something that's in a container that you just pull off of the shelf and administer to the patient within a few hours of writing the prescription, which is not the case with a lot of this immunotherapy.